Welcome to Lesson 10, which focuses on post-fire safety, recovery, and hospital continuity planning. This session is critical for understanding how a healthcare facility transitions from the immediate chaos of a fire incident back to a state of functional stability. We will examine the systematic steps required to ensure that patient care is maintained and that the physical environment is rendered safe for both medical staff and the public. Our discussion will bridge the gap between emergency response and long-term resilience, ensuring that the hospital can withstand and recover from significant fire-related disruptions. Throughout this lecture, we will emphasize the importance of methodical inspections, patient relocation strategies, and the continuous refinement of emergency protocols to prevent future occurrences. Immediate actions after a fire are the first priority once the flames are extinguished. Evacuate and secure area means you must ensure all patients and staff are moved to safe locations immediately to prevent further harm. Control remaining hazards involves the active identification and elimination of any remaining fire or smoke hazards that might linger in the ventilation or structural pockets. Notify authorities requires you to inform fire services, hospital management, and emergency teams about the incident details to initiate the official recovery phase. Each of these steps is vital to stabilizing the environment before any assessment of the damage can begin. In the speaker notes, it is emphasized that communication must be clear and constant during these initial moments to avoid confusion among displaced departments. Safety inspection and damage assessment must be conducted before any normal operations resume. Assess structural damage focuses on inspecting affected areas to ensure buildings are safe for re-entry, looking specifically for compromised walls or ceilings. Check equipment condition is the next step, where you examine medical devices and infrastructure for damage or malfunction caused by heat, smoke, or water. Identify ongoing risks requires a thorough determination of whether hazards remain, such as chemical leaks or electrical shorts that could endanger staff or patients. These assessments form the foundation of the recovery roadmap. The notes remind us that specialized technicians should be consulted for complex medical imaging equipment that may look intact but could have internal soot damage. Patient and staff safety remains the central focus during the transition period. Relocate patients if needed involves moving patients to safe areas within the hospital or transferring them to other facilities as required by their clinical needs. Staff protection measures ensure that healthcare workers are not exposed to lingering smoke, fire, or hazardous areas while they perform their duties. Monitor health and well-being is a continuous process of checking patients and staff for injuries or smoke inhalation effects that might not be immediately apparent. This proactive monitoring helps in managing the psychological and physical impact of the event. According to the speaker notes, tracking the location of every relocated patient is a legal and safety requirement that must be managed with high precision. Recovery and restoration of services is the phase where the hospital returns to its core mission. Restore critical services means you must prioritize resuming essential medical and support services, like the emergency room and intensive care units. Repair and replace equipment is the logistical task, where damaged devices and systems must be repaired or replaced promptly to avoid long-term service gaps. Temporary service adjustments involve implementing temporary solutions, such as mobile clinics or redirected workflows, to maintain patient care during the physical recovery of the wards. The speaker notes highlight that financial documentation of all repairs is necessary for insurance claims and hospital budgeting. Every action here aims to minimize the downtime of the facility. Hospital continuity planning ensures that the lessons of the past inform the safety of the future. Review incident response allows the team to analyze how the fire was managed and identify specific areas for improvement in the reaction time or coordination. Update emergency plans is the formal process of revising hospital fire safety and continuity plans based on the lessons learned during the actual event. Strengthen future preparedness involves implementing new procedures, training sessions, and resources to prevent future incidents from occurring. The speaker note suggests that a multidisciplinary committee should oversee these updates to ensure all department needs are met. This final step transforms a crisis into a learning opportunity, building a more resilient healthcare environment for everyone involved.